So, a lot of stroke care has been made a kind of a hyped up and marketed very well by hospitals and healthcare professionals, to the point people think if a person has had a stroke, you need a physician who treats it, or maybe a neurologist who treats it, or a stroke specialized neurologist who treats this. Once that's done, what do you do? Oh, find a physical therapist, occupational therapist, speech therapist, etc. But what people don't realize is everybody involved that I've mentioned so far isn't trained to rehabilitate a stroke. They're trained to do their job. So a general medicine doctor will manage the vitals and those kind of things until the person recovers. A stroke physician will do all the special tests after the stroke has happened to see what caused it or what could be done to prevent it in the future. The neurosurgeon comes in and removes clots or aneurysms that can actually cause the stroke. Very important stuff to do. But from there, no one knows what's left, but the person's still alive, so call in paramedicals. And if they can't walk, a physical therapist will make them walk. If they can't use their hand, occupational therapy will make them use their hand. And if they can't speak, speech therapists. But what's happened here is everybody is so concerned with their little part, they don't see the bigger picture. The bigger picture is getting a person to do what they can do. So who does that? Doctors like myself, physiatrists. We are doctors who are trained in function, so it's no longer just an organ system or a disease, but it's the entire person as a whole. Because the entire person as a whole doesn't decide that they want to do something, no amount of anything else is going to change anything. And we've had people who come in, they have a stroke, they get all the best treatment, but they have no will to live, nothing else that they want to do, and they reinfarct later and then they expire. Or they survive, but they just get endless therapies and they never really make progress from there, and no one knows what to do. So the whole thing that we do in rehabilitation and stroke care specifically is have a person identify what goals they want to achieve, and we set a plan to make that happen. That sounds like nothing. That sounds like a conversation. But actually there's a lot more involved, because you see, the thing is, all therapies have a limit. They can only achieve so much. There's two reasons they can only achieve so much. One, because there's a disease. Two, because there's limitations to how much a person can achieve after that. So when a therapist is failing now, you need a doctor who's trained in function to attain function. And what that means is either refining the therapy, because the therapist knows their work, they don't see the bigger picture of why they might be failing. Sometimes there's medical complications that actually get in the way of rehabilitation, where a therapist doesn't know what they are because they're not medically trained, but also they don't have the skills to overcome it. So those are things physiatrists do, and those are procedures that we can do to improve function overall. So not only do we look at function, but we actually help restore function with all the different things we do. The problem is not many people are interested in this kind of a field, so it's not as popular, and you don't see too many of us. But high quality rehabilitation done correctly, is done by a physiatrist and not by everybody else that I named in the beginning. They're all important players in this, but they all have a limited role. All these therapies make a gain for the first year. After that, they're not going to do that much more. So what does the person do for the rest of their life? Find a physiatrist.